दोस्तों, हम एक बहुत अहम मौजू पर बात करने वाले हैं। दरअसल आप लोगों को मालूम होगा कि पिछले हफ्ते एक खबर आई कि मिशन में आरसीएमपी की जानिब से एक खबर आई कि एक 5 साल की लड़की फेंटनिल ओवरडोज के चलते हॉस्पिटलाइज हो गई हैं। फिलहाल रिकवर तो कर रही हैं, लेकिन इससे बहुत सारे बड़े सवाल जो हैं पैदा हो गए हैं। एक तो फेंटनिल इतनी आसानी से मिल रहा है, लोग क्या एहतियात बरत रहे हैं। दूसरा, जो ये फ्री ड्रग्स प्रोग्राम था, क्या ये उस हिसाब से नहीं चल पाया है जिस हिसाब से इसका तसव्वुर किया गया था। इसके लिए आज हमने गुजारिश की थी सरी-क्लोवरडेल एमएलए बीसी कंजर्वेटिव्स की एलिनोर स्टर्को साहिबा से। एमएलए वो हमारे साथ फोन लाइन पर जुड़ गई हैं। आइए इनको खुशामदीद कहते हैं और इनसे जानते हैं कि ये इस मौजू पर क्या सोचती हैं। एमएलए एलिनोर स्टर्को, थैंक यू सो मच फॉर कमिंग। गुड आफ्टरनून टू यू.
Good afternoon. Thanks for having me on.
I'm still trying to wrap my head around this fact that a 5-year-old girl could overdose on fentanyl. What are your thoughts on this?
Yeah, it's shocking. It's extremely shocking. I think that, most people, who are reasonable would think that this is crazy. And there's a lot of questions, to be honest, that I still have. Mm-hmm. I'm relieved to know that police are investigating. How is it that fentanyl falls into the hands of a 5-year-old child? Mm-hmm. How is it that they're unsupervised with that fentanyl? Was this a prescription or was this illicit fentanyl? I think there's still more questions than answers, but I think there's no disputing that this is an extremely concerning incident.
And that also raises a lot of concerns about how this free drugs policy has worked. This experiment, we have the data that says that people are still dying, although there have been some dips in the last few months, but these cannot be seen as a trend. These could be outliers. So things have more or less remained the same. In fact, we could argue that things have actually worsened because now that there is a certain category of free drugs, people have become dependent. Once that stock runs out, they try to acquire other options. Do you think that's what is happening?
Interestingly, there was a review, a study that came out yesterday from the Journal of American Medicine that found that the government's safe supply program and decriminalization were both associated with increases in overdose. Mm-hmm. So it wasn't necessarily tied to deaths. Mm-hmm. There was insufficient evidence to say that they caused increases in deaths, but they increased the number of people overdosing and they increased the number of people that were in the hospital. One of these things is that you're correct. We do know that the number of people overdosing right now has decreased, overdosing and dying, but that's actually a phenomenon that is being seen across North America. Mm-hmm. So it can't be actually tied to any of the crazy policies that the NDP have implemented over the last 8 years. In fact, I think that we've seen more evidence of harm as a result of things like the government's funded safe supply and their decriminalization experiment than we've seen good. And I think, being a critic, so my role in the previous sitting of the government was mental health and addictions critic. That's a portfolio that actually no longer exists. They rolled that back into healthcare, and now I'm the critic for public safety and the Solicitor General. But look, they have never proven that their wild experiments were helpful. They've never proven that they would not cause harm to other people. And in fact, what we've seen over the last 2 years is that they have ignored evidence that their programs actually hurt people. The number of overdose deaths that we had in the 15 months of the decriminalization pilot brought into this province by the NDP and approved by the Trudeau Liberals in Ottawa was the deadliest period of time for overdoses that we've had in the history of our province. And we know by the government's own leaked documents, their own presentation, that their government safe supply program that is taxpayer funded, so that's your tax dollars paying for drugs that have been significantly diverted into the hands of criminals, fueling the fentanyl trade and enriching gangs and cartels in our province, and that the government admits that taxpayer-funded drugs distributed by this NDP government have been trafficked here in British Columbia outside the borders of this province and even internationally.
Is there anything called safe supply?
No. I think that honestly is a negligent misrepresentation. It is negligent to say that there are safe drugs. In fact, this entire PR campaign of the NDP and the federal Liberals to call drugs safe is extremely negligent. And to categorize what we're going through in this province as toxic, a drug crisis, look, all drugs are toxic. Even Tylenol is toxic and you can die if you take it wrong. The reality is that instead of focusing on trying to make drugs safer, they need to try and help people get better. The opposite, right now they call it the unregulated drug deaths. Because the opposite of unregulated drugs is legal drugs. They want to legalize drugs, these people. And so we need to start looking at it in terms of a crisis of people who have addiction, a crisis of trauma, people who need help with their mental health, because the opposite of those things is helping people with addiction. It's giving them treatment. It's helping people with mental health problems. It's giving them treatment and supports, helping people out of poverty. We need to stop looking at ways of fixing drugs and start looking at ways of making sure that we're helping people, and that's the way forward out of this crisis.
What do you think could have been done differently with this?
Pardon me? What could be done differently? Well,
yes, with this policy.
Well, we need to end unwitnessed safe supply in its entirety. We need to end Liberal NDP decriminalization in its entirety, and we need to be pouring our resources into frontline supports for people to be into treatment, which the vast majority of it, we know that we need it to be voluntary services, but for the small but very much needed circumstances where people may need involuntary care in certain circumstances, we also need those options available as well. But look, after these things, people get out of treatment, people go out of detox, they need housing, they need, in some cases, because they have brain damage, they'll need lifelong support. The sooner we get off this crazy train that we're on now of trying to fix drugs, the sooner we can put our resources into programs that we know will help people and that will help them recover.
Elenore Sturko, thank you so much for speaking with us this afternoon. We really appreciate your time.
Well, it's always a pleasure. Thanks for inviting me on.
Thank you. MLA एलिनोर स्टर्को जो कि बता रही थी कि ये दरअसल क्योंकि 5 साल की लड़की एक तो पहले कि इतना केयरलेसली आप हैंडल क्यों कर रहे हैं कि घर में एक 5 साल की लड़की एक जार में फेंटेनिल को एक्सेस कर सकती है. मैंने किसी और से भी सुना है कि किसी साहब ने कोक का कैन लिया, पी रहे थे और बेहोश हो गए क्योंकि किसी ने शायद उस जहां से रैक से उन्होंने उठाया था, किसी ने शायद फेंटेनिल या किसी ऐसे ड्रग का इस्तेमाल किया होगा और उसी हाथ से जो है उसको छुआ होगा, नहीं खरीदा, इन्होंने खरीदा, मुंह में लगाते ही फिर बेहोश हो गए. तो इतना ये खतरनाक हो सकता है. ओपियोइड क्राइसिस को चलिए एक मसला है ही. मैं उनसे वही जानने की कोशिश कर रहा था कि क्या अलग किया जा सकता है. उन्होंने कहा है, पहले से कह रही है, वैसे अभी की बात नहीं है, कि इसको बंद करने की ज़रूरत है. इसको बंद करने की ज़रूरत है क्योंकि डेटा नहीं बता रहा है कि कोई सेफ सप्लाई है. ऑल ड्रग्स आर टॉक्सिक. तो ये चीज़ समझाने की ज़रूरत है.